Yeah, we do some celestial
Oh,
discharge.
back myself in the corner here. I'm sorry.
And then
I
people
hope you
forever
wanted to help you
home.
how broken our healthcare system is, and part of that discussion is a lot of people can't even get to see their PCP for like 6 to 8 weeks.
You need to come here now. I'm like, I'm hot myself. I'm cramping up. Like, and
What are you gonna do? You can't. Hi, everyone, and welcome back to Banter at the Bedside. We are here today with some guests to talk about what it's like to be the quote unquote town healer or the person in medicine that everyone comes to in your outside life to ask questions. As always, this is for entertainment purposes only. This is not medical advice. Please actually seek the medical care of a medical professional and not just ask the medical professional in your life. Also, we don't represent any institution. All the thoughts and opinions are our own, again, entertainment only. Today we're joined by our other main co-host Kaylee. Everybody, welcome back.
We've got our current reoccurring co-host Cody back.
you know,
And today we are joined with a very special guest, Dr. Tyler, who is a hospitalist that we Hello. also met through social media. Tell us a little bit about yourself, Tyler. Yeah, I am a hospitalist trained in internal medicine. I've been in practice. I finished med school in 2014, finished residency in 2017. Big fan of the Bengals. I currently still live on the East Coast. Um, I got a wife, 4 kids, and I recently, like November, decided to create a TikTok account, and it was a very big change in my life. Yeah, we we
Got your
understand that a
hands
little
full.
bit. Yeah. Mhm. We connected. Dr. Tyler's another one that we connected with on social media because, again, our kind of missions and values align. Do you want to kind of touch on it? I know you've made a intro video about it on TikTok, but since this is a different audience, I thought I'd let you kind of give your personal mission as well. Yeah, I decided you're not gonna believe this if you see a lot of my reels, but I actually thought that it would be good to kinda connect patients and providers and medical staff because there is such a big disconnect sometimes between some of me and my patients. And I'd mentioned to you previously that I used to do a podcast back in the day. I mean, it never went anywhere. It was just me and a buddy of mine having some drinks and rambling, and it never like did it wasn't anything close to what you guys are doing here. But the point of that podcast and the point of what I was trying to do with social media was try to like bridge the gap between, why are my patients always mad at me and why don't they understand what's going on, and where all these complaints come from, and then why are hospital staff always fighting with each other? Why are cardiology, nephrology always fighting? Why are doctors and nurses always fighting? Um, and that was honestly ultimately the point of why I decided to create a social media account. I'm abbreviating a little bit, but that's okay. So then I made that social media account. I learned that if you are sarcastic and funny, you get a lot more followers a lot quicker. So in the name of nurturing and growing my social media presence, I did kind of detour through trying to be a sarcastic, funny guy for a little bit, and I'm not gonna say I'm super famous, but I got 5,000 followers, so that did help. But then once I hit the 5,000 follower mark, I thought, okay, let's go back to my original purpose here. Let's go back to me trying to be serious and try to connect the patients and the families and the healthcare employees. And I stumbled across you guys. If I remember correctly, I think Abby, I think I saw you doing a reel about RQI, right? I think
Yeah,
I
yeah.
think that was the one that made me reach out to you, and I was like, oh, I hate
Mhm.
RQI, and now here we are.
Yeah, RQI. Oh, my crash out on RQI. Kaylee was there, and that was, like, 2 minutes of her just,
Of
like,
a
filming it,
20-minute saga. The
but
provider
it
RQI is ridiculous. I don't know who makes that, but y'all need to rework that.
I can't
yeah.
imagine why they think this is better than now we have to do this 4 times a year. That can't be an improvement. That can't possibly be.
No.
No, but the
Our
nursing version is so much quicker than what Abby had to do, so we can at least, like, get it done.
Yeah. They for some reason, ours makes, the providers do, like, two-person and you swap. So
you have to do it's like 4 straight minutes of going back and forth between compressions and breathing, and then it doesn't work, and I'm so short for the thing that I can't get on it, and it always takes me forever. I didn't even pass that day of the filming that we did. I had to go back and try a different day, but yeah. Uh, I love your mission. I love and it really aligns with what we want to do here and why we don't just talk about straight education. We like to kind of pull back the curtains on what it's like to be a healthcare worker and how that how the different perspectives in healthcare also, as you touched on, the fighting amongst staff, like having different perspectives and everyone sitting down at the table together is so important for us. So I'd been seeing your stuff for a while, and when you reached out, I was like, "Oh, yay, okay." I wanted to reach out, but I didn't wanna be like a weird fangirl.
Yeah. I had seen
So
your
I was
stuff
excited.
too.
Yeah.
I heard you just use the word fan. It's strange to me that I have fans. That's very strange to me. I'm not. I don't know if I'm ready for that, but it's fun. It's fun.
Yeah.
No, I feel like your stuff
Yeah.
resonates, oh, yeah, if people just could understand that, like, same thing.
Mhm. We did copy you. I saw you do the Jackass one. Um,
That's how I got the welcome to Jackass trend. My wife was like, "Hey, there's this trend going around. Welcome to Jackass. Do you think you should do something funny with that?" And I was like, "Oh, I got some ideas." And
yeah.
I made 4 of them. My work asked me to take one of them down, but there's 3 that are still up. And I think I got like 3,500 followers from those welcome to Jackass videos, which is crazy to me.
Yeah. So we saw one and we copied it and we had one of our attendings do it on our shared page.
I
And
love that.
yeah, it was crazy. I was like, and it was like 2 minutes. I was like, say this. And he did it one take and it lined up perfectly. And then all of a sudden, all everyone in the comments was going crazy. But
One take. That's
yeah, we pride ourselves on a lot of one takes.
fantastic.
Yes.
Most of my reels average about 5 or 6 takes.
My individual ones, I do. Kaylee's really good though. But, well, I've been really wanting to talk about this topic mainly for semi-selfish reasons. I'm the oldest of 6 kids, and I'm the only medical professional, and I kinda wanted to take an opportunity to call out my family for how much they call me as their go-to. So, I wanted to see if anyone else's experiences align with mine and what it feels like for everyone else to kind of be, as I call it, the town healer or the go-to person just because I'm in medicine. Ever since I got that nursing degree, I've always been getting text messages, getting put in group chats. Have you guys experienced that?
All the time.
Yeah.
100%.
So my favorite story that I have of one of my sisters did this. She had just had knee surgery, and like the week before, she had like been on a crazy long flight, and she texts me about like 6, 7 days after, and she's like, "My foot's still really swollen and I'm having a lot of pain. What do you think?" And I'm like, "Well, send me a picture of your foot." And I'm sure you guys all know where this is going to. And she's like 21 at the time. And all of a sudden, I get this picture. And if I can find it, I will add it into the video. But it was huge. I was like, "Oh, well, you got to go to the hospital right now. You got a blood clot." And she was like, "Nah, it's fine." And I was like, "Well, why'd you ask me?" And then the pain got so unbearable, she did eventually go to the hospital at like 10 p.m. at night. And then she had just a giant blood clot throughout the majority of her leg. And they're like, "Yeah, you should have one come earlier, but thank God your sister told you." So I was like, whew, that
Shouldn't
one
leave the
was a
foot
save.
idle.
How old was
Yeah.
she?
She was 21. Well, it was from the surgery and she literally like got off a plane, like a 10-hour plane ride, and then the next day went and had surgery. And then was
Jeez.
immobile, and they didn't do any, like they didn't send her home on anything to
I love
even
that she waited till she asked you, and then she still was like, I'll just see how it goes."
I'm gonna wait till it gets really bad, then I'm gonna go.
yeah. That's what except for one of my sisters. One of my sisters, when she asks, she will do what I say, but the rest will ask and then not do what I recommend. And so I just need to know if anyone else experiences that when they are asked for medical advice.
I my I'm kind of like the pair of like one of my college roommates and one of my high school buddies, my dad and my brother. And most of them are pretty compliant. And by that I mean I'm like, hey, just try this, or hey, it's rare that I'm like, you need to go to the ER, get checked out. I think I've only told them maybe once or twice in all the years that you need to go to the ER. The one I have, my high school friend, he just ignores. And not only is he the most frequent flyer, but he also ignores everything I tell him. I've asked him several times, like, why do you even ask me for advice? You're asking me for advice all the time, and then you ignore my advice all the time. I think he just kind of uses an excuse to talk to me, which is great. I love that. I love talking to him. Like he like he'll ask me for like one time he didn't have a bowel movement for like 5 days, so he asked me what he could do about that, and I told him. He's like, "Well, I don't want to do that." Okay, okay. You afraid you're gonna have a bowel movement? I don't understand.
Yeah.
Maybe he should take some Miralax and some Pepsi.
I
Oh, God.
Miralax and what?
It's what one of the doctors that had been on did. Is like our second episode, and he thought he had a bowel obstruction, so he mixed his Miralax in Pepsi
Oh
and
yeah,
drank it,
that makes sense. Yeah.
Among like 5 other things.
Okay.
among many other bad decisions.
So you
Or
told him
He
what to
did.
do, and he was like, "No, I don't wanna do that." I don't get it.
yeah, but most
I
of the
mean,
rest of it,
I think that's nice that he like uses it as an excuse to reach out, though.
potentially he's a little
Potentially.
he's a little neurotic at baseline, but so I don't know. It's fun.
Do people try to get you to write them prescriptions?
That's what I get asked for the most, and I would, but there was one time one of the nurses asked me to prescribe some, and I had to call it in, and I tried. I'd never called it in. I'd never had to call in because I work in an ICU, and the pharmacist was like, "Is this actually your patient? Like, are you actually a prescribing provider?" Because like, they're like, "What's your NPI number?" I'm like, "Oh, let me go look that up." They're like, "What's their date of birth?" I'm like, "What's your date of birth?" Like, I was 0 prepared to call it in at all, and I was like, I will
You
not
gave up?
ever do this." Yeah. I
Did
was
they
like,
ask
"I
you
am a
for
pro."
photo ID? I could see them really doubting that you were Abby.
Well, yeah, they were like, "Yeah, you're going to have to send this electronically." And I was like, "Okay, I'll get right on that."
I know, but that's what most people I don't think people out here trying to get, like, pain meds or, like, crazy stuff. It's like, just, "I need the antibiotics." Like, that's
Yeah,
all we want.
antibiotics are
Mhm.
very common.
A lot of people don't know too, at least for APPs, I can't like, I'll have out-of-state people, and as I've already made clear, I'm cannot call it in, I don't have that ability, but I can't actually prescribe outside of my state. Um, I can only prescribe within my state because I only have an active license in my state, so when my family from Wisconsin is like, "Can you do this?" No, I even if I could figure it out, I I actually cannot prescribe outside of this state. At least that's what our state license says, which is fine. It helps me easier avoid the embarrassment of trying to call a CVS pharmacist again.
The traumatizing experience of calling CVS.
I was so embarrassed. I was like, "Oh my god." They
But, I mean,
definitely
you rarely have to do it over the phone. Nobody does it over the phone. Like, everything's electronically. They don't like, does anybody even write paper prescriptions anymore?
I haven't seen a paper prescription since I graduated residency. My residency is 14 to 17, and I think that's right when we were moving from paper to electronics.
yeah.
But I don't think I've ever actually seen. Sometimes I'll have to print a paper script for a discharge going to a nursing home. I don't count that. Like I've never seen like someone actually go with a
The
paper.
pad.
Yeah,
Yeah.
No one
Like, I
no
wonder
one
if the
has the
younger
pads.
people out there even know what we're talking about. Like, physicians and whoever, they used to carry around, like, a paper pad. I guess you've seen it maybe if you watch, like, an old medical show, and they would, like, write out the prescription and give it to you. You had to take it, and you had to go in person and hand it to the pharmacist or the pharmacy tech. Like, you could
That's
you imagine
All
now?
my Adderall and Vyvanse was prescribed when I first got put on it. She gave me a few months of prescriptions, and then I would go and get my Vyvanse filled.
Yeah,
Mhm.
Like
times
27,
have changed.
18.
Yeah. They used to give, like as a provider, you'd, like, start hospital orientation or wherever, and they give you your prescription pad, but not anymore.
Yeah.
Could you imagine?
I just remember them harping on it in school how to prescribe with that.
I've got, like at this point, it's like a push button in my memory, like, I push the button, "Hey, this is da 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 da, my cell phone is da 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 da."
You also do more outpatient discharges than I've ever
Yeah.
done
Yeah. If you work in
from
an ICU, then, yeah, you're
yeah.
almost never helping someone leave the hospital. I
I
mean,
mean, I am.
just I'm sorry, I chose that was a very poor word choice. I meant my goodness gracious, that was a terrible word. You're never discharging someone, you're never helping someone transition to out of the hospital, discharging them. Wow, I that was
Alive.
my bad.
DC to JC is what we say.
Yeah, we do some celestial
Oh,
discharge.
back myself in the corner here. I'm sorry.
And then
You know
people
No, you're
I
forever
know I
fine.
hope you
from.
know what I meant.
No, it's fun. I don't Cody, you told me a story when I told you about this. Are you going to share it
Yeah.
about this topic?
Yeah. So it's so different being like when you're in the in the hospital, your mindset taking care of patients is different than when like somebody in your family asks you something. I feel like I go blank on certain situations. And this was when my mom first got diagnosed with cancer. She kept calling me about her symptoms, about coughing up blood, and I was like, you probably just have TB. Meanwhile, stage 4 lung cancer.
It but it's just only TB. Like, that's
Only yeah,
I
just
didn't
that
even
was
like
TB.
your
go there down the
just
cancer
like only TB.
If
That's
you're
one
coughing up
difference.
blood, something ain't right.
Something ain't right, but I just didn't take it
You
there.
should go to the doctor.
Well, I told her that.
You did advise that.
I did. I did.
Wow, good for you.
I think that's for me, situations like that when it's certain symptoms or like weird things that I'm like, I just, ugh, you just gonna have to go somewhere where they can fully work you up. And that's one of my other sisters. And she'll send me videos of her friends and their symptoms. And I'm like, yeah, you guys like I got a video of like an open hand from a knife. And I was like, yeah, I can't assess this from a iPhone video. You're going to have to just go to the doctor and see if it needs a stitch. They're like, do I need stitches? I'm like, I'm not judging your hand cut from a knife from a video. You're just going to have to seek care.
Yeah, you need to get
No.
checked out. My brother has asked me to stitch him up 3 different times, and
Your
I'm like,
brother needed stitches 3 different times? Is he an MMA fighter?
"No," and I don't know if he ended up getting stitches or not, but he would send me like, I'm not a trauma nurse, and I don't really like to see big open wounds, it's not for me, and it'll be the same thing, it's like a picture of like, "Oh, my fingers have sliced off," or, "Look at this," and I'm like, "That's not my area, okay? I don't even work in the emergency department, like, you don't want me stitching you up. I can't sew, I've never done it, like, you're gonna have to go get a professional, and you probably need to get that cleaned and, probably an antibiotic when he was younger, but I'm like, he keeps on asking, I'm like, "I told you the last few times." And I was like, "No, man, I can't do that. Like, you just need to go stop getting cut up or whatever you're doing." I don't know. Fun time, fun late night stuff, but I think mostly, like, when my people in my family will ask me stuff, I'm telling them not to go to the doctor. It's like they're not hypochondriacs by any means, but it's like, "Well, this, and this, like, I think do I need to go?" And I'm like, "No, you don't need to go. That you're fine. Don't go." And then they'll just go. I'm like, "Well, have fun." And they're like, it's because it's like a Saturday urgent care. I'm like, "Well, you're gonna be there forever. I wouldn't have gone if I was you, but what do I know?"
I
Just for them
usually
to tell you
agree.
it's a virus and not do anything, but
I usually
good
agree.
luck.
One time I got burned, it was actually, unfortunately, my wife. She She dropped, she dropped a trash can on her toe, and the toe really hurt, and she's like, "I think it's broken, I think I need to get checked out," and I'm like, "Honey, you're not gonna break a toe just dropping a trash can on it, like, that's not how the human body works, like, unless the trash can was full of bricks or something," and there was a lot of trash in it, but I'm like, "Honey, you did not break your toe by dropping a trash can on it," so for, like, 3 days, she just walked around with pain in her foot. Finally, against my advice, she went to urgent care, checked out, and guess what? It was broken, and so I felt real small. And to this day, a joke in this house now is, well, it's not like there's a ton of bricks in that trash can. And it's just a reminder of the bad medical advice I gave her. She had to wear a boot for, I mean, it didn't change much. She just had to wear a boot for a little bit. It's not like she's going to lose her
Yeah.
foot. That was
No.
the one time. Haley, I mostly agree with you. I try not to send people to expensive ER visits and urgent care visits. And 99% of the time I'm right. But that the one time I was wrong, my wife had a broken toe and I gave her bad
That's the
advice.
worst time to be wrong, though. I feel for you. That's ammo for life right there.
Yeah. And then I'm sure if she asks you a question again and you're like, "No, you're fine," like my toe.
Yeah. She remind me of the time that I said, there's a ton of bricks in that trash can," and that quip that I said will haunt me for the rest of my life, allegedly.
Then I'd be like, "You know what? I'm not taking the trash out anymore. Mm,
But she
that's
didn't
not my
usually
job."
anyway. She didn't usually anyway, so this is just one more,
This is so another ammo. This is why I shouldn't be taking the trash out.
precisely.
Yeah. But also, like, I'm just a nurse. I'm not here to diagnose things. Like, in my realm of work where I work, like, sure, but like if somebody wants to ask me about their kids, I'm like, I don't feel comfortable telling you anything about your kids. I only know what has been told to me about my kids when they were little, and that's not a lot. So I'm like, I really don't want to tell you the wrong thing. So when it comes to like kids and stuff, I'm always like, just call the
Yeah.
pediatrician.
I don't
Like,
touch kids, which is frustrating because after probably the most common request I get is antibiotics for like either UTI or a respiratory infection. That's number one. Number two is someone wants me to talk about their kid or look at their kid's rash. And I can't touch like internal medicine. No, no, not even close. Like I have
rashes.
managed a kid since like clinical rotations back in 2013. I'm not qualified to talk about kids. And
No.
it's a little scary when they ask me that. And I have a very, very low threshold to say, ignore me and take it to the pediatrician.
Yeah.
Yes.
Yeah. When people ask me about their kids, I'm like, I've never I don't even have kids. Like, I don't have my own kids. So, and I've never taken care of kids. I've always done adults. So, I haven't taken care of a child since nursing school, and that was 2 rotations. And I'm like, I just automatically set up that boundary of like, I don't, I don't know. You're going to have to speak to someone else. It's not me. It is not me. But
I think there was once or twice where like the kids sounded really, really sick, and there were like some social financial barriers preventing them from seeing a pediatrician soon. And when that happened, I called. I got a buddy of mine who is an ER doctor because I mean ER sees kids too, right? And I called my ER doctor buddy, and he was able to then triangulate that curbside to my friend. But I said, even then, like, you can't, like, this can't be official. This can't be serious. Like, you got to connect with a pediatrician. You can't be asking an internist to talk about a pediatric problem.
no. I mean, I think this kind of touches on something else thinking about it. Do you guys think that all these like curbsides or families or my family's my mom's friend asking me stuff, do you think it kind of also speaks to just a larger issue of how hard it is to even get an appointment or how
Yeah,
hard access is? Even when people have insurance, just getting some of these appointments for some of these simple questions can
yeah,
be weeks,
yeah. And
months.
Yeah.
And that's why I try to be, like, easygoing about that stuff because, like, I mean, I do think one of the biggest problems in our country is how broken our healthcare system is, and part of that discussion is a lot of people can't even get to see their PCP for, like, 6 to 8 weeks, and, I mean, that's terrible, and I can't be everyone's PCP, but I can when my friends or family ask me for help. I'm happy to help as long as I think it can reasonably manage my curbside. I can happy to help, assuming, of course, they don't have any complicated medical history, assuming they're not lying to me about anything. If we
Yeah.
can do those things, and then I think a curbside can be appropriate. I know curbsides are a little controversial. There's a lot of people who don't believe in curbsides, and I respect the controversy, but I also feel like, we have virtual medicine for a reason. We have virtual visits for a reason, and we also have an 8-week backlog on getting people's seen. I personally am a fan of curbsides,
Yeah.
uh, but but I do respect the controversy, and I do know why a lot of people refuse to do that.
And I think, yeah, if people want to refuse and set that boundary, I think that's fine. I think that there's, a level to that too of like, I'm not always on, right? I'm not just your sister that's an NP, or I'm not just your family friend that's an NP. Like, I have other facets, and when it's the only thing that you only talk to me about, sometimes it feels a little
I
oh,
definitely go I definitely there's 1 or 2 people that, like, when I see my phone, they're texting me, like,
mhm,
I know what they want. They're not
yeah.
taking a lead, that's for sure.
It's like, we're even past the point of, like, the courtesy, like, "Hey, how are you doing?" Like, I don't even get that, I just get
I've
random
got one time a couple of years ago, it's probably like 2019 or something. I was I'd flown to San Diego for a wedding, and this was supposed to be like a relaxing weekend, San Diego. I've never been to California before. It was fun, and like as soon as the plane landed, I turned on my phone and I got one of those texts. Okay, as I'm navigating the rental car and driving to the hotel, I'm like, and that request like really ruined like the first hours of my trip to San Diego, and I was a little annoyed. Like I was a little
yeah,
annoyed. I was annoyed at I know that they, didn't realize I was on San Diego on vacation, so I try not to hold it against them, um, I don't know. If
yeah,
that happened more often, then I would not do that. I would not be doing these
yeah,
fun excursions, but that was kinda the exception. That's not something that happens that's certainly not the norm. Most of the time, like, I'm, like, just farting around watching TV anyway, and it's not a big deal.
yeah,
I think it's funny that these people, like friends and family, will ask us for advice or whatever, but, like, the people in the hospital won't listen to us.
Yeah,
Literally,
yeah, exactly.
it's like, okay.
Or, like, I made a reel about, what I gotta go through to get a patient their prescriptions on discharge, and then I know that these patients are just gonna throw the pills away and they go home anyway, and
mhm,
it's a very deflating, frustrating feeling.
It's like, "But no, you actually need to do this,
Yeah.
please."
Exactly.
what about, I don't know, I'm sure Cody kind of probably experienced this, but has anyone else I know Cody was, but has anyone else been asked to be people's healthcare power of attorney because they're in medicine? Because I think right now I'm like 4 people's healthcare power of attorney. I have 4
Yeah.
parents, to be fair, so
I think
I could get you to be my healthcare power of attorney, honestly. My mom had me do that, which I'm the oldest, but also I think it's more because I'm a nurse. Mhm.
I think my brother asked me to do so. Um, I think my mom it's probably my mom's will and my brother's will that I am, although it's not something we really talk about very often.
yeah. What about you, Cody? I know you were your mom's and
Yeah, I made all the decisions, or medical decisions, and look, my dad is a DNR. He tells me that every all the time. That's just what he wants. So
My
does
mom
it
tells me that all the time too. She's like, "Just cut the cord, pull the plug," and I'm like, just
that's literally
relax."
what he says. And then he does stuff like falls off the roof or falls out of a tree, cutting branches, and doesn't go to the hospital. He's like, I'll be fine.
does he ask you to come look at him when he does those things?
No, I found out like hours later when my stepmom calls and's like, your dad's on the way to the hospital.
Oh my god.
Fill me in.
So
But I feel like that's also kinda like the unspoken thing for a lot of medical professionals that people will ask you to be their healthcare power of attorney or assume you're going to be, and then it's like, well, all of a sudden I'm healthcare power of attorney to so many people, and that's also a lot to bear.
Yeah, it can be, yeah. I have my stepmom is also a PA, so I'm not the only medical person in the family. So she's able to help absorb some of that from me. Like I'm sure she's my dad's power of attorney, for example.
Mhm.
And
Yeah.
probably there's probably like a whole side of the family that knows her better than they know me. So she's
Mhm.
probably the power of attorney for them. You don't have
Yeah.
anyone else in the I heard you say you're the oldest of 6 and no one else in your family is medical?
Not of the kids. I have a cousin who's a doctor, so he kind of we he kind of absorbs it, and his wife is about to finish her fellowship, so they kinda help, but we always seem for the extended family, we always get tossed into the group chat together, except for the one time, which this is crazy. Just to preface it, everyone was safe, in the end, everyone made it, but they were his parents, my parents, a couple of my sisters were on a trip in the Dominican, maybe? I don't know. That they were on a trip and they found my one sister passed out and felt like they couldn't feel a pulse. So they started CPR and went to the hospital. She was fine. She woke up. But they called my other sister, who's a wildlife ecologist, first to tell her and ask her what to do. And she's like, "Why are you calling me and not Abby or Luke, the doctor? Like, Abby's a cardiac ICU NP and Luke's an actual doctor. Why are you calling me and not them?" And me and him found out like last, and we're like, "What's going on?" Like the one time we should be called first is the one time we're not called
Yeah,
first.
that's strange.
But,
Call
sure,
911.
they were in the Dominican.
Oh,
Or
well,
there was no 911. I mean, they went to the hospital there, she was fine, but there was no 911 there.
in the world? Why did she pass out
So,
like that with with such a non-palpable pulse? Lord have mercy. That's scary. Do you guys ever get, like, if you're out and about and somehow somebody finds out you're like a doctor or nurse or whatever, and then they be asking you stuff, you don't even know them?
Yes, yes.
Old people, I love old people. They just wanna tell you all their ailments immediately, and it's like, "Oh, God, okay." And I can't do anything because 'cause they're so cute. They just wanna talk to somebody. That's, like, all they have to talk about at that age, It's like they don't talk about shows or music, they, like, talk about their health problems.
No, I have when someone talks to me about it in public, it seems like they're like they either can't see their PCP or they're like dragging their feet on seeing their PCP. They're like, well, I could make an appointment, I don't want to, so I'll just ask this guy at the supermarket instead. That'll be just as good. And that's kind of like the feeling I get. Like they really have been thinking about making an appointment and haven't. I
yeah,
remember
and
late 2020, like right in the middle of COVID, I was working at a small. I was just doing some moonlighting at like a small hospital in a small town, and the restaurants had just started to open back up. So I left one day for lunch. I left campus and went to Applebee's. I was sitting at Applebee's at the bar, just enjoying my lunch again. This other married couple sitting over there, they saw us wearing scrubs and they're like, "Hey, you a doctor?" And I'm like, "I just want to enjoy my grilled chicken fajita wrap here." But I was like, "Okay, yeah, I am a doctor." And they're like, "Do you think I should get that COVID vaccine?" And I was like, "Oh my God."
no.
And I'm like, it seemed like it was like halfway medical, but also halfway like political. Like they wanted to start a political argument about it. And I just have this like delicious plate of food and fries in front of me. And I was just like, I don't know, man. Like, I think you should talk that over to your primary care. Like, I barely know you. And then, of course, it turned into a political discussion. I'm like, okay, like, here we go. I just want to eat my chicken wrap here.
You're
And
like, "I'm just sitting at Applebee's, let
yeah,
me eat my lunch."
like, can you not see the food in front of me here? Like, I'm
Mhm.
not here to talk about politics or medicine. I'm here to eat my food.
Yeah.
That happened. That was probably the most annoying one. I've had other minor ones kind of like that too.
That was very common during that time.
My wife and I are cursed though. We moved to our current city about 6 years ago, and three times in those 6 years, which is actually kind of a lot if you think about it, we have been out in public and stuff went down,
S
like chest
Oh,
compression. Yeah,
oh, yeah.
like like every other year it happens to us, and we have joked that we're cursed by that. And she's a nurse. My wife's a nurse practitioner too, and so we feel the right thing to do is to go over and assess the situation. But
Mhm.
it's always again. One
Yeah.
time we were at a Japanese steakhouse, like trying to enjoy. It might have been our anniversary, but it was supposed to be like a dinner, just the two of us. And then we looked over there, and everyone was running, and everyone was screaming. And then we saw chest compression, so we were like, "Oh, damn it!" And like we went over there and stabilized things until the paramedics arrived. And that happens to us a curious amount of times. But
Yeah.
That's
I've done
crazy.
I've done chest compressions in public twice. One was on the day that I got engaged.
wow, before or after you
And
got
before, which, like, was, like, it was, like, a whole comical story of events, and, like, my now husband told me he was sleeping, so I was at the pool, and this guy, like, passed out in front of me, and the lifeguard just, like, threw him on the chair, and he's, like, not breathing, doesn't have a pulse, so, like, me and another nurse code him. EMS comes. There was apparently, this he was apparently a local, and EMS knew the girl he was with, so then there was a fight, And then the hotel security guard in Vegas wanted my information, and I was like, "No." Like, "You're not going no." And so then my husband's still sleeping, and so I go to the long story short, I go to the blackjack table and I got drunk. I told the dealer about it, about all of it, and she's like, "Our lifeguard didn't do what they're supposed to, that's crazy." And so she starts waving down every cocktail waitress, and they're making sure my cup never gets empty. I'm just drunk out of my mind at this point, on a hot streak, and then he proposed, and I sobered up real quick. I was like, "Oh, goodness." It was a very eventful 12 hours. It's a
When you said the chest compressions were before the proposal, in my mind, I was thinking like it was your boyfriend who you resuscitated, and he was so grateful, so appreciative that he proposed to you. But I don't know. I
no,
guess
it was just a stranger.
yeah.
I've never had to do chest compressions on anybody in the world, like out in the wild.
So
I
Have
actually,
you?
the Japanese steakhouse, actually, the chest compressions were inappropriate. The patient was like awake and talking, so I actually stopped the chest compressions. I myself have never actually done chest compressions outside the hospital. Fortunately, I guess I probably should.
I've done them on I was on my way to work. I was driving into the parking lot, and I see, like, there's, like, a car stopped, and then I just see, like, a body in the road, and I was like, "I don't know what's going on." So I, like, stopped. Tech was, like, crossing the street going into work, and where that intersection was, it was very dimly lit, but, I'd gotten off work early, stopped at the stop sign, didn't see her, hit her, her head hit the windshield, and then she hit the ground, and I started doing I did compressions, we got Ross and everything, but when she got to the outside hospital, she was brain dead,
Hmm.
and it was her birthday.
Oh,
Oh, you're just really bringing this up with the
I
story.
know. It was so bad.
No.
And
That is
another nurse that
terrible.
showed up after the fact got the Daisy Award for it, and had the audacity to turn around and look at me like, "Thanks for having my back, Cody." I said, "Whatever."
My God, that's right. She got the daisy.
Yes.
Girl.
And I'll never be early for work again.
Never
right.
happened since, don't worry.
Learn your lesson.
If you had won the
Parking
Daisy, would you?
huh? If
If
yeah,
you had
if
won
you had
the
got the
Daisy,
daisy?
would you keep coming
No,
into work early?
no.
Okay,
I'll be
so
on
we have, like, the parking department with, like, the police and parking buildings that are, like, way off campus, and I was in there, I think I was trying to dispute a parking ticket or get something changed, I don't know, I was in there, and, the lady that was working behind the desk was like, "Are you a nurse?" I was like, "Well, yeah." "I have a question." I was like, "Okay." And she needed a shot, and it was like a hormone shot or some sort of shot that was like a IM shot, and she didn't wanna give it to herself. She was like, "Could you give it to me?" And I
That's
was
kind of
like,
sweet. That's kind of
I
sweet.
can't remember. I'm like, "Well, could I whatever I was in there for?" She was like, "Yeah, yeah, 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 yeah." And I was like, "Okay." So we went in the bathroom, and I gave her little shot, and I got out of there quickly. But I was like, "You don't even know me, like, just because 'cause I'm a nurse?" Like, I don't know, I felt like that was putting your
Well,
trust in somebody
I've
or
heard
something.
nurses are the most trusted profession in America.
Yep.
You heard that?
The yeah,
I
we've
remember
been
I used to hear that.
Yeah.
Like,
yeah.
I say that in hospitals, and people say, "No, that's not true," because everyone wants to hear the doctor read the CAT scan report. They don't trust the nurse to read the CAT scan report. But outside of hospitals, like out on the streets and everywhere else in America, the most trusted person walking up to you, number 1 is nurses, and number 2 is college professors in terms of, like, are you just going to believe them? Doctors are, like, 11 or 12 on that list. People don't trust us. So I guess I'm not surprised that someone asked you to inject them. That's
Mhm.
that's that's a very wholesome story.
Yeah, it
Yeah.
was cute. I was like, "Sure." I mean, I've done it a bunch of times, like, I'm fine with it. It's something that you've been prescribed, like, she was telling me what it was, I can't it was something legit, and I was like, "Yeah, I can help you out." Like, I know a lot of people don't wanna give themselves shots. It's no big deal.
No, that's hard.
I'm
What's
surprised that
the
people still think that nurses are that trusted, just judging on people's behavior.
I think we get a skewed version of that in the hospitals because in the
Mhm.
hospitals, everyone expects me to come by and read the CAT scan to them as if the nurse is not capable of reading English, the same things I have, which is frustrating. But outside of hospitals, I kind of, I don't know, I believe that. I do.
Yeah. So we've had supermarket, we've had or Chick-fil-A out at a restaurant. We've
Yeah.
had
Japanese steakhouse.
Japanese steakhouse, we've had parking ticket office. Cody, do you have a weird I mean, middle of the road, I guess, but I guess that's where you would expect a car accident. Do you have any weird spots that you've been asked to help or answer a medical question?
Not really to answer a question, but like to hell. My nephew's baseball game last summer, the umpire was dehydrated and cramping up, and everyone's like, I was already in the car. I was ready to go. It was so hot out there, and my sister calls and she was like, "The umpire is cramping up. You need to come here now." I'm like, I'm hot myself. I'm cramping up, like, and
What are you gonna do? You can't start him at IV. Like,
right. I said he needs fluids and he needs some electrolytes.
some ice on him.
And we had, like,
Gatorade.
one little mini bottle of Gatorade in the midst of the sports complex, a mini Gatorade. And somebody from another team was like, "We have something, we have some stuff," and it was a fruit punch, like a family-sized fruit punch pack. I'm like, "Nah." Anyway, he would barely drink the water. He was like, I can't swallow, I'm cramping up." I'm like, "Okay, I'm done here. I need to
Somebody
call
call the
some
ambulance.
emergency services."
One of the more awkward conversations I had, um, was there was a nurse. I mean, we shared like, a dozen or so patients together, so we like recognized each other, but we weren't really like friends by any means. We were coworkers at this point. One day at work, she's like, "Hey, can I ask you a question?" And I was like, "Yeah, sure, of course." And she starts telling me about these symptoms that her boyfriend was having for a couple of weeks. And there's only really one reason that men in their 20s go to the doctor, so I was a little suspicious. And it was really awkward because I was a little like on my differential was gonorrhea. Um, and I wasn't really sure how to like say that because I was like, well, does she really want me to be honest and be helped, which will kind of introduce a new chapter to our relationship as coworkers here, or should I just kind of like shrug and say I don't know if he should see his PCP? And I didn't really. That was a very uncomfortable position for me to be in. Um,
Yeah.
I bit the bullet and I just told her, I was like, "Hey, are you sure he doesn't have gonorrhea?" And I tried to make it like funny, but like
Also
funny,
not fun.
like I'm not really joking,
Yeah.
and it turned out it wasn't gonorrhea, but for that day, I was very uncomfortable. I was very uncomfortable. I wasn't really. I mean, I have to. My job is to keep a broad differential here, and I
Yeah.
got a male in his mid-20s with some strange migratory joint pains. You can't really rule out gonorrhea there, and that was a very strange day. To this day, that nurse and I
Yeah.
are friends, so I don't know. Maybe she was mad at me for suggesting such a thing, but
How dare you
like I
give
said,
that
I don't know. Does she want me to be honest, or does she want me to be nice? I didn't know.
I mean, if you're going you gotta be careful what questions you ask. You're not always gonna like the answer. That's
Yeah.
crazy. I thankfully have never of all the questions have never had any related to anything sex. I do get a lot of rash. I get a lot of rashes. I don't know why. I get sent a lot of skin, and I've told the same person multiple times that I'm not a dermatologist. It's like outside of kids, it's probably the one I know the least. Like
Mm.
I'm like, I don't know. I mean, it's probably just contact dermatitis. I mean, it's one spot on you. I don't know what to tell you,
Good
but I get
CVS
a lot of
hydrocortisone cream.
Oh my
that's all
god.
I say. It's like you can try some hydrocortisone cream and that's it. But I'm like, I don't know why you keep sending me rashes.
There was this partner that got pulled to us one day, this is a long time ago, and she didn't work with us, and she was, like, having a very heated discussion on her phone on FaceTime, and she was, like, walking around and going in and out of the patient's room, so I was kind of, like, trying to corral her to get her out of, like, a patient's room because it was starting to get very heated. And it was between her and her boyfriend. And then it turned into this thing where it was sort of like he was having some symptoms that she was concerned that he had like an STI and that he would have cheated on her. And then she goes, "Here's a nurse." And she turns it around to me and she starts they start involving me in the whole thing. And I was like,
Here's a nurse with nothing better to do than to help referee this discussion.
I don't in my head, I'm like, I don't even know her, but also like, get off the phone. Get off the phone. Like we're at work. I don't know you. This is incredibly uncomfortable. Like this is you're telling me all these things and he's like she's like, show her." I was like,
I
I
would press the end button.
mm-mm. I was like, "You need to get off." I was like, "You need to get off the phone. If you need to leave because you can leave." I was like, "Please don't." I said, "You can't keep doing this. Like, everybody can hear you. Like, the patients can hear you. The families can hear you." They had
What
no
did
shame at
sh
all. She was like, "Show
what
her." I
did
was like,
she
Don't show
show you
me."
what though? His penis?
Yeah. Something with that was going on, and there was, like, some I I was like, don't, don't do that."
My god, at
I
work
do think she
too,
ended
like,
up leaving because I was like, "You can't." I said, "You gotta go. Like, you gotta get off your phone. Like, you can't be walking around saying what you're saying."
It's
that's
incredible.
crazy.
Yeah.
I love Cody
I hope
being
they
like,
got it
"I
worked
would've
out.
just hit the end button."
Literally.
It was a very it was heightened.
I bet.
I didn't wanna mm-mm. No shame.
Okay. Oh, those are yeah, I'm glad no one's asked me any STI questions or maybe led me down to, like, an STI because I don't know if I would how I would handle that. I would
I'm sure you'd be very professional.
Probably easier if you don't, like, know them if you're not friends with them, you know? Like, that nurse who I, like, kind of casually
yeah,
knew barely knew her last name, and I was about to tell her I thought her boyfriend had gonorrhea. That was a very uncomfortable feeling that I would not like to
yeah. I think some of them, like, some of it's easy, right? Like women, you know what a UTI feels like, you know what a yeast infection feels like,
Mhm.
easy ones are easy. Broken bones, I guess Dr. Tyler's gotta be a little bit more varied in that diagnose.
so I just counsel ortho, that's all I do.
I just call it but I think it's
I
and
love it.
I do think some of it is a reflection of how long it takes to get into a provider or in how busy now urgent cares are or ERs are. And so I do understand the, hey, let me ask. Let me ask someone else that in my life. And I don't mind it. Like I've kind of touched on, I still want an established relationship with you outside of I am your medical person in life. But I do think it is a bigger reflection of kind of our broken healthcare system and people utilizing whatever resources they can to get the access that they need in a more timely fashion.
Mhm.
Yeah.
Absolutely.
Who knows, maybe in, 5 or 10 years, everyone will just have Amazon as their primary care, and then, they won't be asking me for all this free medical advice.
True.
Just found out about that the other day.
What'd you say?
Yeah, Amazon has a pharmacy that you can, like, chat with them and stuff. I didn't know about that.
Yeah.
What?
I, like, ordered some stuff on Amazon, and then, like, a pharmacy ad popped up, and I was like, "Oh, we're getting too taking this too far now."
Yeah. They have the pharmacy.
That's crazy. But
They have
any
everything.
any final thoughts from anyone on or final stories on what it's like to be the town healer, the medical professional in everyone's life or strangers' lives? Apparently, it seems like there's a lot of talking with strangers.
Plus,
A lot of fun.
no.
Like, talking just
I'm just glad to know that I'm not alone in these experiences, and maybe my sisters can feel a little bit validated that they're not the only family members asking people questions.
For sure.
From all of us shift talkers here at Banter at the Bedside, we'll talk to you next time. Make sure you hit the like, follow, and leave us a comment. Tell us your story about your favorite time or the craziest story, weirdest place that someone asked you for medical advice. Or have you had to have the awkward STI conversation? Let us know. We really want to hear it, and we'll talk about it on a future episode. Until then, thanks. Bye.
Bye.